Hi there, Patrick Dooley with Sterling Physical Therapy, lead physical therapist and board certified orthopedic clinical specialist. I'm here with one of our physical therapy assistants, Angie Bates. We're going to be demonstrating how we use the VibePlate in the clinic. These examples today will be how we use it for activation. One of the things with the vibrations, what we're trying to do is we're trying to activate the individual muscle fibers of the person or the athlete we're working with. So if somebody's doing a movement like a squat, yes, the muscle's activating, but we want to try to get the most out of that muscle. The muscles are made of little fibers that all connect together. So with the VibePlate, we're able to get more activation by just almost upregulating those nerves or kind of exciting those nerves of the muscle. So what I have with Angie today is a setting of 55 Hertz. This is more of a muscle activation setting. So with Angie, let's say she has an ACL, something that we may want to do to activate is just simple weight shifts to get her quad going. So what I'm going to have Angie do is just shifting her weight back and forth, just slightly bending the knee. Perfect. So again, we have an ACL, maybe having trouble with some quad activation. This is a very simple exercise that we would do here at the clinic on the vibration plate. Now let's fast forward. The athlete's starting to activate that quad more and we want to get into more of a functional movement. So now Angie's going to go into a mini squat. And again, that vibration is constantly helping those muscles activate through her quad. Perfect. Now, as we want to get to the strengthening component, the next step I'm going to have her take is a kettlebell. And again, these are just a very few examples of what we do in the clinic with the VibePlate. There are thousands of things you can do with this. So what Angie's going to do is a goblet squat. She's going to go through a full range of motion with the kettlebell. Coming down, keeping good posture. Good. Back up. Keeping it tight to her chest, coming down. Good. The next one we're going to do after this is another variation. It's going to be a Sumo Kettlebell deadlift. So just having the legs spread wide apart, dropping that weight down, good, keeping that back tight, good. Again, getting glute activation, hamstring activation, perfect. And Angie, you can go ahead and set the kettlebell down. Now the next one or last one is more of a sports performance type exercise. So what I have on either side of the vibration plate are stretch bands. And one of the things we want to work on is getting power from the ground. So with an athlete doing a power clean, doing a hang clean. So what Angie's going to work is just almost like a little bit of a vertical jump. She's got the bands by her side, and all she's going to do is go into a mini squat and exploding up. Perfect. So again, that first part of that hang clean, power clean, snatch, where you get that hip extension. And again, we're using the VibePlate to help activation, which then hopefully in return what's going to happen is she's going to go do her hang cleans, power cleans, and she's going to be able to see that one, she can probably do more weight eventually, and then two, she feels faster and she's generating more power from the ground, which again would mean increase in her maxes. So again, these are just a few of the things that we do at Sterling Physical Therapy with the vibration plate with several of our athletes.